The word syrinx means a cavitation. Syringomyelia refers to a cavitation or a dilated fluid-filled cystic cavity within the central canal of the spinal cord. It can occur due to trauma, tumors, or in association with Chiari-1 malformation. We talked about Chiari malformations in the anterior neural tube defects lecture, so if you haven't watched it, make sure to check it out. Okay, so now the patient has a spinal trauma or tumor, and this led to the formation of a dilated fluid-filled cystic cavity within the central canal of the spinal cord in what we call the syringomyelia. The syringomyelia most commonly occurs at the spinal cord levels from C2 to T9. It initially only damages the neural fibers passing near the center of the spine, leading first to a damage of the spinothalamic tract second-order neurons as they cross the anterior white commissure. We explained the spinothalamic tract in the ascending tracts lecture, so if you haven't watched it, make sure to check it out. The spinothalamic tract is responsible for pain and temperature sensations, and it ascends from the spinal cord to the brain. As it ascends the spinal cord, it passes anterior to the central canal in what we call the anterior white commissure. So a damage to the anterior white commissure will affect the spinothalamic tract and cause a bilateral loss of pain and temperature in a cape-like distribution in the upper extremities. And then as the disease progresses and the cavity enlarges, it can affect the lower motor neurons of the anterior horn, causing upper limb muscle atrophy, weakness, and flaccid paralysis. And then it can affect the paravertebral muscles, causing scoliosis, which is a sideways curvature of the spine. And if the disease is untreated and the cystic cavity enlarges further, it could affect the lateral horns, causing Horner syndrome. If you want to know more about Horner syndrome, make sure to check out our lecture on the topic. But basically know that the Horner syndrome presents with ptosis, or eyelid drooping, anhidrosis, or lack of sweating, and miosis, or pupillary constriction.